So next we have Gab Lawrence and Jen Coe. I'm not sure, Alex Cottarella, if you're on the call as well, but they're going to be speaking to the substance use services around COVID-19. And just a reminder, we have 2 more evaluations to hear from. Yeah, in order to give them enough time and space to share, I'm wondering if folks are okay to stay on a few minutes after 12. That would be great. And then we can maybe have some time for questions.
So Alex is on vacation now, so it's just myself and Jen as the co-leads for this portion of the investigation. So I just wanted to say thanks to Ahmed because he created a really great context for the hotels. As Michelle kindly introduced me, my name is Gab Lawrence and I'm the manager of harm reduction services at Parkdale Queen West Community Health Center. And we were one of the agencies redeployed to the hotels to uplift the harm reduction initiatives and community teams that supported individuals within the recovery sites to address whatever harm reduction needs came up. And in this particular portion of the evaluation, we're specifically going to explore the populations that use drugs that came through the hotels. And a significant element of focus is the way in which we had several different partnerships come together, and there was a lot of process of negotiating how to uplift collaboratively harm reduction initiatives within the hotel. So we really wanted to ensure that we provided people with appropriate support while they were there, and that was the range and the spectrum. So, you know, we would be talking about managed alcohol programs. We eventually uplifted a overdose prevention site in both the COVID positive program as well as what's known as the query program, which is for close contacts and people under investigation for COVID. This is also inclusive of safer supply and different types of drug substitutions for folks, given that there was a lot of complexity with individuals using drugs in the hotels being so disconnected from their regular supply that we really had to create accommodations to ensure that people had fair access without the enforcement of like a withdrawal management plan for people. So we ended up coming together and building a lot of different tools that were geared towards a client-centeredness, you know, some of which included a substance use menu. So we realized that the context of the recovery sites were really complex for folks coming in, and there was no reason for anybody to trust us as we were representatives of the institution. And so instead of on takes, for example, say, asking people to disclose their history of drug use to complete strangers and having no reason to, again, trust us. This menu is an example of like leaving it in folks' rooms so they could disclose should they choose to. And on that menu, we provided like the different options that they had. So on their own time, on their own way, we're able to connect with the teams. And so you know, with the involvement of a really large peer team that were really the backbone of the project in terms of harm reduction support there, as well as the community team and the nursing team. We really had many opportunities to discuss how our different philosophies and values had to align in order to create the best client care that we could within the context of COVID. So those are very brief snapshots of some of the work that we did, and I'll let Jen talk a little bit more about what we'd be looking for in the evaluation.
Thanks, Gab. I'm Jen Coe. Many of you probably know me from my previous role as the program manager at Moss Pond. Rather recently, with Inner City Health Associates as the clinical nurse educator, working with their 2 sort of nursing programs, which are primarily at the recovery hotels and then also in the physically distancing hotels. In our conversation so far, like many of the other groups, we're still clarifying exactly what we're going to look at, with a considerable thought being about not duplicating any of the work of the other hotel group. but we are interested in looking at those interpersonal dynamics, or interprofessional groupings, and how those dynamics have both been challenging and also fostered the kind of innovative programming that has happened at the hotels. I think in some contexts, we've also talked about the way in which those programs are necessarily low barrier, but also not necessarily so because of the context of the pandemic and the hotel specifically. We're also interested in looking at some of the outcomes for folks that have participated in the programs, whether that's like how many people did participate in the various programs, or whether that's how connected they remained afterward to similar or approximations in the community. We're not quite sure yet how that'll look, but we will be working on figuring those pieces out. Gab, did I miss anything?
Well summarized.
Thanks, Gab. Thanks, Jen.